What's up guys, Daniel Ndukwu here, and in this video, I want to talk about something really interesting. A multi-billion-dollar Silicon Valley darling went from a $9 billion valuation to being worth less than zero. As a matter of fact, they were owing creditors a couple $100 million when all the dust settled. Few startups are ever valued at $1 million. Getting to $100 million is harder than most people can even imagine. $1 billion valuation is practically impossible. It's part of the reason why startups who actually achieve $1 billion valuation are referred to as unicorns. Just like the beasts of legends, they're mythical entities. The company I'll be talking about today smashed the $1 billion valuation, got to $9 billion on the back of heady investment rounds and valuations as a result thereof. Now, when the dust settled a couple years ago, the founder was on the hook for fraud charges, was banned from working in their industry, and all type of craziness. So I'm going to dive into that in just a second, but before I do, make sure you subscribe to the channel and like this video for the YouTube algorithm. Let's get to it. Alright, so the company I'm talking about is named Terrance. So what is or what was Terrance? It was a medical diagnostics company founded in 2003 by a sophomore in Stanford, the 19-year-old Elizabeth Holmes. It claimed to have developed revolutionary blood testing technology where instead of taking a vial of blood from your body, they would only need 0.1% of that amount and get accurate results. Naturally, that was revolutionary. Basically, you didn't even need needles anymore. And the situation was that this process would be done by small, automated machines that needed very little maintenance, so you could slash the cost of medical diagnostic tests. Now, this was a revolutionary breakthrough in a $70 billion industry, so it's natural for them to have a valuation of $9 billion, pending the fact that the technology worked. Now, from 2003 until the company went bust, they were rewarded for these so-called innovations by receiving over $1 billion in various types of funding. In reality, they never had a working product.
Say what? Say what? You must have get that with me.
So how did so many Silicon Valley venture capitalists and institutional investors like private equity funds get fooled into thinking that this company was legit, that it was producing results for clients and partners? Now, to really answer that question, we need to take a deep dive into the journey of Terrance. So back in 2003, over 15 years ago now, Elizabeth Holmes was a sophomore in Stanford, and she came up with an idea to develop a patch that could be worn on the skin, adjust dosing of medicine, and alert doctors with relevant diagnostic information. That initial idea evolved into a diagnostics company that could take blood samples, lessen a drop, and give accurate results. Now, there are so many challenges with this, and first and foremost, contamination. A drop of blood can be easily contaminated, whereas a vial of blood is much less likely to be contaminated, or if there's a contaminant, it can be isolated, and you can use the rest of the blood for the diagnostic test. The premise of their company was the fact that they would be able to change this and only take a drop of blood, in some cases even less. This is known as lab-on-a-chip technology, LOC technology, and this is what we refer to as bleeding edge technology. It's way out there in the fringes, and most people have no idea about it. But if you get it right, you can make a lot of money. So inspired by this idea, she dropped out of Stanford in her sophomore year and used the education trust her parents had established for her to establish a company called Real-Time Cures. The name was quickly changed to Terrance because people were skeptical about any company that had cure in the name. And even though she used her educational trust to start the company, she knows she needed a huge amount of money, or a lot more money, to start a medical diagnostics company properly, do the research and development, hire staff, because frankly, she had no relevant skills. So she went out and sought investor funding. But the problem is that investors, as much as they like crazy ideas that can change the world, they need something, whether a proof of concept prototype or a clear roadmap to get you to the promised land. She had neither. So instead of doing that, Holmes sat down with her computer for 5 days and typed up a patent application. And that application read, I quote, medical devices and methods capable of real-time detection of biological activity and the controlled and localized release of appropriate therapeutic agents. A bunch of jargon. But the thing is that a patent application isn't the same as a patent. And so you may be wondering, why does that even matter? Why do people even care? So here's the thing. One, it's difficult to actually submit a patent application, but the United States Patent Office actually has two things that need to be taken in consideration before you can be approved for a patent. The first one is utility, meaning that the invention actually has to work. And the second thing is enablement. This means the patent application has to be clear enough so that people who are reading it in a relevant field can actually build and utilize this product or this invention. But there's one problem. It's actually a big problem. The U.S. Patent Office, if you care to do a little research, is notoriously bad at establishing both utility and enablement. That's why a lot of patents are out there and they don't actually have a product that can be built based on the patent. So since most people don't realize this, Holmes applied, so she now had patent pending technology that she could pitch to investors. You know what that means? It means you're one step away from having intellectual property for a revolutionary piece of technology.
Oh my goodness, oh my damn, oh my goodness, they're going ham.
That is game changing, and investors were really interested. So Holmes used family connections to land her first investors. As a matter of fact, the first person to drop $500,000 inside of Terrance was actually her childhood friend's dad. So this was in 2003. By the end of 2004, she had secured over $6 million in investment funding. Once you get the first investor, it becomes much easier to get the next investor. So throughout 2004 and for a bit of 2005, they hit the drawing board. So in the beginning of 2005, they released the first design, not a prototype, mind you, of their technology. Now, it was named Terrance 1.0, and it was quite different from what they had initially pitched investors and what that initial patent application talked about. But this was kind of like a bridge invention so that they could license it to pharmaceutical companies and then use the revenue generated from there to continue development of the main technology, the one that she pitched investors when they gave her funding for that LOC technology, lab on a chip technology. So this was going on. She didn't get any major takers. They had limited trial runs with some large pharmaceutical companies, but nothing really came of that. So in 2006, Holmes was running out of money. She had hired an all-star team and was paying them industry standard salaries, which you may realize that biotechnology research isn't cheap. So they went back to the investors, not their same investors, but a different group of investors, and raised another $9.1 million. This time, they had a lot more fancy designs to show investors and a promise that the prototype was almost done. And at this time, they had also initiated other patent applications. Now, way back in 2006, the first crack started to appear. At the end of this year, after they raised the $9.1 million, the CFO was fired because he raised concerns about, one, the ability of the technology to deliver on its promises, and the honesty of the company when it comes to its finances. Right after firing the CFO, Terrance went and raised another $28.6 million in November 2006. Now, I want to really make this clear. At this point, Terrance doesn't have a working prototype, but they've raised somewhere around $40-something million.
What you talking about, Willis?
Now, this is crazy, but then again, it's biotechnology. It costs a lot of money to get these products to market. So let's keep following the story. So the next year, in 2007, the still not ready Terrance 1.1 was used in a study for medicine that was treating terminally ill cancer patients. There's really not much information about the results of Terrance 1.1, but it was something that Holmes and the team could point to and say, look, we've been used in clinical trials with real patients. Give us more money, or we're going on the right path. So over the next few years, it seemed that Terrance really decided to double down on their technology, and they didn't raise any money or make any major changes until 2009. That's when Terrance hired Elizabeth Holmes' then boyfriend, Sunny Balwani. He had a background in engineering and business, and so he came on board as the chief operating officer and the president of the company. That's when things started to get really, really interesting. Now, I'm going to end this video here, but things start getting really, really interesting, and I want you to stay tuned for part 2 of this video.